On January 15, 2019, KFL&A Public Health received a complaint about infection prevention and control practices at Dr. K. Luco Dentistry Professional Corporation in Kingston, Ontario. KFL&A Public Health investigated the complaint and found that there were times when proper cleaning and proper sterilization of dental instruments did not occur. Instruments that are not properly cleaned and not properly sterilized can spread infectious diseases such as hepatitis B, hepatitis C, and HIV. The risk of infection in this situation is believed to be low. People who were treated at this clinic between January 1st, 2010 and January 16th, 2019 are asked to make an appointment with a healthcare provider to discuss next steps. Dr. Kira Moore, Medical Officer of Health at KFL&A Public Health, provides the answers to some questions the public may have about this occurrence. What types of infectious diseases might patients be at risk of getting?
The diseases that we're most concerned about are hepatitis B, hepatitis C, and HIV. These are blood-borne infections that can be transmitted through contact with blood or bodily fluids.
What is the level of risk to patients?
It is important to know that we believe the risk to patients is low. The risk to an individual patient depends on what type of procedures were performed and how often at that clinic during the specified time period. Many people with hepatitis B, hepatitis C, or HIV may not know that they have the infection and may unknowingly spread it to others. We do not make these decisions lightly and have consulted with experts in the field.
What should I do if I was a patient at this clinic between January 1st, 2010 and January 16th, 2019?
We encourage patients who receive treatment at that clinic during the specified time period to speak with their healthcare provider, review their risk, and, with consent, be tested. The results from testing should be available within approximately 2 weeks.
How will patients be notified?
Patients will receive a letter and a lab requisition in the mail from Public Health. We ask that you bring that letter and lab requisition to your healthcare provider to discuss your risk, get counseled, and consent to testing as required.
If you were a patient between January 1st, 2010 and January 16th, 2019 and did not receive a letter in the mail, you can download a copy of the patient letter, physician letter, as well as the laboratory requisition from KFL&A Public Health's website. For more information, visit kflaph.ca/IPAC Lapse.